Hi, thank you for joining us. I'm Dr. Besso here with a patient, Patricia, that's going to share her story. So, well, thank you for being here. So, just tell us, what brought you in to see us.
Well, I was diagnosed with Meniere's disease back in 2008. So, over the last 11 years, I've had periods of stability and instability. I would have flare-ups from the Menieres, different. When they were active phases, it was bad vertigo, where it was spinning, and I would be out all day in bed. And that usually I had migraines with that, nausea, and that would happen for months at a time, but off and on, maybe 2 days in a row, then I'd have a couple good days. So when I'm in my inactive phases of vertigo, which have been, again, like I said, over the past 11 years, I would have a couple active, but with treatment, I could be a little more stable to manage those symptoms of the vertigo. But when I was in a stable period, I still had a little bit of ringing in the ears, but then more of a fullness took over that came with some hearing loss and just kind of a sense of imbalance. I wouldn't have active spinning, but I did feel like almost as if somebody would kind of push a little, and if I would bend down, it almost felt like somebody was, so a little swaying in that. So that has kind of been, probably the last couple of years, that's where I've been, where I haven't had active vertigo, but definitely, unstable moments, and the fullness in the ear.
Okay. So then what brought you in here, or what made you think, okay, I want to try something different?
Well, my sister-in-law and I both have looked. She helped me along the way with finding different treatment plans and things on the internet. So we always kind of did research, what's the latest that's coming out that we could kind of see. And she came across an article that talked about a doctor who was a cervical chiropractor and was doing research on Meniere's patients and an association with neck injuries. And that's what prompted me to recall back in 2002, I was in a car accident. I was hit from behind, and I definitely suffered whiplash. Never really made a connection at all, but once I read those articles and the research, I thought, this is definitely worth checking out. And after discovering a lot of things on the internet, I came across you. And after seeing videos with you in it, I thought, this is definitely worth checking out to see if this is what could be causing all my symptoms I've been having. So.
Okay, great. So then you came in to see us. So we found a problem in your neck and in the alignment of your neck, and then how have things changed since coming to see us?
Well, I didn't realize how many headaches I actually was living with before, and they're so minimal. So that definitely is probably the biggest improvement. Also, I didn't realize how stiff my neck was as well, and my neck feels so much better. And the instability I was having is very minimal as well. I don't feel that little bit where I'm a little swaying off and on sometimes. So definitely those three areas for sure have improved.
Well, great. And we've seen a great structural change, as well on the alignment, and we're continuing to work on that. But well, thank you for sharing. This gives other people hope that are coming in with problems.
I do want to mention too, because for me, didn't know much about chiropractors to begin with, and I always think of that. I'm going to be in some contraption, it'll be with my neck, and that's a little scary thinking, what's he going to do with that? And when I came in and realized it's so gentle, and the procedure you do, it's so fine-tuned, to work with that area, and that put me at ease, because of all things, I was really nervous about working on my neck, so so I like that. That made me feel real good about that.
Well, keep up the good work. Thanks again for joining us. Okay, we'll see you soon.
Okay, sounds good. Thanks.